Hi, good morning Felix. My name is Jenny McGrath. I'm your invigilator for the OET-speaking session on the 12th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Felix Bather.
And what is your candidate number, please?
My candidate number is 2228017.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why did you decide on a career as a nurse?
I want to be a nurse because nursing is my passion. I come from a reputed family of nurses. Both my grandmother and my mother are nurses. I have grown up in that environment and seen how much they love what they do every day. Their work is very inspiring and motivating, and I'm very proud to continue the tradition of nursing in my family.
What is your most incredible skill as a nurse?
I think my most significant ability is to listen to what a patient tells me. From a patient perspective, it is very frustrating that no one hears you. I have spent 5 years in the medical field working directly with patients and find that active listening can go in helping make someone comfortable. As a result, I was appointed as a trainer for a patient advocacy program to teach other nurses.
How was your experience as a nurse in your previous hospital?
Last year while working as a nurse, I was asked to handle a tough patient. I did my best to listen and provide comfort. As she was leaving, she said, "I'll never forget you as long as I live." It hit me that my life was important to her. That's what makes nursing so meaningful to me.
How do you practice self-care?
The job of a nurse is very challenging. Along with the emotional pressure, there may be some other issues such as job timing, night shift, etc. So, we have to be fit and fine for this job to be available all the time. That's why I exercise and meditate daily. Along with this, I have some stress-busting hobbies such as gardening and cooking. These all help me a lot.
What are your strengths and weaknesses as a nurse?
My biggest strengths are my compassion and my ability to solve complex problems. In my previous job, an older man came to the hospital that had night terrors. He would wake up screaming every few hours. I took some time to talk to him. I quickly found that just 10 minutes of conversation took away his fear. After that, I have spent the next 5 nights with him. His night terrors left and the other patients on the ward could sleep peacefully again. My biggest weakness is that I forget to eat my meals when I get involved with the patients.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning. My name is Felix Bather. I'm one of the nurses working in the community health center. Can I have your name for the record, please?
Good morning, nurse. My name is Jenny McGrath. You can call me Jenny.
Hi, Jenny. How may I help you today?
Yes, I have received a letter about my daughter's grommet surgery. The letter mainly conveys the surgery date and the fasting requirements. However, I want to know more about it.
Sure, it is my pleasure to explain it to you. First of all, for better understanding, a grommet is a small tube that's placed in your child's ear during surgery. It drains fluid away and keeps the eardrum open.
All right.
The grommet should fall out naturally within 6 to 12 months as your child's ear gets better. The surgical preparations are similar to other surgeries. So far, is it clear for you?
Yes, but nurse, for a 2-year-old child, fasting for a long time is really tough. Is it quite necessary to do that?
I appreciate your concern. But fasting can prevent unnecessary complications during surgery, such as cough, gag reflexes, risk of vomiting. Talking in detail, due to anesthesia, aspiration can happen. The solid or semi-solid stomach contents may enter the airways, and not let the lungs get air. Liquid stomach contents that are acidic may also burn the lungs. This may cause brain damage, or even death. This is less likely to happen when the stomach is empty because of fasting. That is why fasting is important before surgery.
Oh, I see. I wasn't aware of it. Now, I understand the importance of fasting. Nurse, let me know how long my child should stay without milk and food.
As a mother, I can understand what you are going through at the moment. Jenny, it is mandatory to avoid food and milk products 6 hours before the operation. You also need to stop clear liquids 2 hours before the surgery. Perhaps you can continue oral medication with sips of water, if required.
All right, nurse. I am quite upset because my child may feel really hungry and thirsty. I don't know how she will cope with this.
I acknowledge your worries. As mentioned before, you can give her some clear fluids until 2 hours before the surgery.
Clear fluid? May I know what exactly you mean by clear fluid?
Yes, of course. A clear liquid diet means clear fluids that are easily digested and leave no undigested residue in the intestinal tract. For example, she can have some apple juice, but not orange juice.
All right, I got it now.
I can assure you that, during and after the operation, your child will be given intravenous fluids. So, she won't feel tired.
Thank you for letting me know. Now, I'm feeling a bit relieved.
All right, Jenny. I would like to know whether you have given any information to your child regarding the surgery.
Oh, no. I haven't talked to my child, as I am not sure about it.
It's okay, don't worry, I can help you. You can tell her without much complications. Just tell her that a cream will be applied to the back of her hands, and get ready for a small sharp scratch. Then she will go for a deep sleep and all. Let her know it is not at all painful.
Sure.
Jenny, you can also convey her the benefits of the procedure. I strongly recommend you to do that.
Oh, yes. Sure.
Let her know that the procedure can help your child to hear better, and it also reduces the chances of ear infections afterwards.
My child will be happy to know that.
Definitely, I can sense that. Well, Jenny, do you have any other concerns?
Yes, I would like to know regarding the hospital stay and discharge.
I am sorry to say that I am not the authoritative person to talk about the discharge. However, I can assure you that once your child is fully recovered from an anesthetic effect, she is almost ready for the discharge. And before discharge, it is important she should tolerate clear liquids and light food. In addition, it is mandatory she needs to pass urine. I hope it is clear for you?
Yes, nurse.
Okay, Jenny, is there anything I need to answer?
No, I don't have any more questions. I feel better about the surgery, and the fasting requirements.
Great to know that. Hope I have clarified all your doubts. We'll meet you on the day of surgery.
Sure, thank you, nurse.
You are very welcome.
That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.